Today we're going to begin our unit on disease prevention and how to be an informed healthcare consumer. All right, got a little handout for you to help you take notes. Here.
Thanks, sir.
Here you go, Dallas. And y'all are in like this focus class. This is how you know you have their control. How many is that, Heidi? 2. So before we begin, this is pretty self-explanatory. The reason you get an annual physical exam, eventually it's going to be on the PowerPoint. I want you guys to take notes on it and to list the 7 ways. And then steps to finding a doctor, list your 3 ways here. Okay? Oh, and we'll do that later. Okay, how to be an informed healthcare consumer. So, ways to be an informed healthcare consumer is to understand the importance of an annual physical exam. Okay. First, we're going to break down what a healthcare consumer is. First, we're going to start with what a consumer is. Someone who buys products or service for personal use. Health is the overall well-being of your body and mind and your relationships with other people. Now we put it all together. Healthcare consumers, any actual or potential recipients of healthcare, such as a patient in the doctor's office, a client in the community mental health center, or a member of the prepaid pharmaceutical maintenance organization. Okay. Objectives for today. The students to recognize the need for an annual checkup and understand how checkups can identify health problems. To students understand how to take proper precaution to prevent health issues. And students understand how physicians are a primary resource to obtain a trusted physician. Obtaining a trusted physician is key to when you're trying to locate a physician that you can trust and that is interested in your well-being and not just in their well-being. All right, steps to being an informed healthcare consumer. Step 1 is to recognize the need for regular checkups in order to pinpoint any health problems. And some problems are easy to recognize. Other problems, such as high blood pressure, is a problem that is not so obvious. That's a sign, and it's important to see a doctor if any of these are coming up for an annual checkup. Step 2, gaining knowledge of any health problem is the next step by learning about the causes, warning signs, and possible outcomes. So you need to be aware of the possible potential outcomes that you're getting involved with your doctor, and say if you have questions about types of medicines or anything, you need to be aware in what's going to happen in a physical. You don't just want to come in there, in a physical exam, he says, I'm going to need to check you and turn your head and cough. That you may need to be informed about that a little bit before you wouldn't want to know that, right, Curtis? Would you want to know that?
Yes, sir.
Yes, sir. Good job, Curtis. And step 3, be sure to follow directions exactly in regards to medications, such as a well understanding of side effects and warnings. Step 4, analyze the information about health so you'll be better and informed when going to a doctor's visit. Now we're going to do a little pre-test. I may ask you to answer these, or I ask you just to be brainstorming when you're doing this. So anyways, here we go. Do you understand the importance of an annual examination by a physician? So, Curtis, do you understand that? Why it's important?
Yes.
Do you understand the importance of an annual examination? Why is it important?
That way we know if we're on track with our health and make sure that, we ain't got some kind of unsuspecting disease coming up on us.
Yeah, very good. Great answer. Yeah, I couldn't have said it better myself. Good job. Do you read the directions of prescribed medications, and are you aware of the side effects of the medications you take? So, Ben, if I were to give you ibuprofen or some type of medicine that helps you, or what is the maximum dosage? You wouldn't know that, correct? If you hurt your knee or sprained your ankle. So, Ben, can you help me out a little bit? Can you tell me what do you think the proper dose of ibuprofen in a daily intake should be?
Whatever it tells you on the bottle.
Whatever it tells you on the bottle. Do you have a guesstimate that you can help me out with? No idea. Okay, well, I'll tell you anyways. Do what, buddy?
I said I haven't taken ibuprofen.
You don't take ibuprofen, not even if you were like weightlifting and you hurt your joints or something. So you just ice and stick to that, to the Rice method. Oh, you don't ice either. Ben don't do nothing. He's Superman. Big Ben, you know, Big Ben. All right, then I'll tell you then. The maximum dose is 3,200 milligrams in daily dosage. So that's 800 milligrams daily every 4 to 6 hours, give or take, depending on your pain and how much you're needed at the time. You can also do 200 milligrams, which will eventually get you right around 1,200-ish, give or take, depending on how many times you're willing to take medications for ibuprofen. Are you comfortable with talking with your doctor about your overall health, including embarrassing situations? Javier, do you want a doctor who you're able to talk about and your embarrassing situations, or you want a doctor that you don't feel like you can communicate well with and and it doesn't benefit you in the long run? What do you prefer?
I'd like to be able to talk to my doctor about anything.
So you want a good doctor that's willing to give you great information and willing to help you out, and they're there for you, not just their own well-being? Okay, excellent. Do you know how to find a healthcare provider? Wes, how do you find a healthcare provider? You call. Okay. How would you find that number? Would you just randomly just be like, I'm just going to dial, and just start typing the numbers and be like, hey, healthcare physician, what's going on? You know, how would you find that number?
I've never had to do that before, but I would guess.
So you've never scheduled your own doctor's appointments?
I mean, I have a doctor now, but if I was trying to find a doctor,
What would you do? Would you use the phone book?
probably.
Probably phone book would be a great option, wouldn't it?
Yeah,
Okay, or like
hospital.
the internet, or talk to your community around you and see what's going to happen. Talk to your like family and friends, see what doctor is and which one's available and which ones are great. Yeah, great answer, man. Appreciate that, bud. Okay, reasons to get an annual physical exam. Screen for diseases and keep updated on your current diseases and treatment. Assess risk. Yeah, pay attention, guys. 7 reasons. Assess risk of future medical problems. Stay encouraged to live a healthy lifestyle. Update vaccinations. You know, you don't want to, if you're going to get a flu shot, you don't want to some old vaccination. That's not going to work. You want the most updated one, correct? Right, David?
Yes, sir.
Thank you. Update medical history, include your family history and new allergies. You know, that's a big thing for the doctor, and let them know about you and your family history and what's going on. You know, in your past doctor visits, like if you were to change doctors, you know, your doctor would want to know that. Right, Kyle? Yeah, you're doing great, bud. Maintain a relationship with the doctor in case of an illness. And then review and renew medication prescriptions. So visiting a doctor will help you actually, you know, renew your prescriptions if you have a prescription, or to help you out if you need to change your medication, or, you know, do what you need to do for your overall well-being, students. Answer or address any questions or concerns. So you want to get a physical exam if you have an irritated bowel movement. You'd probably want to address these questions and concerns to your doctor, correct? Class? Ben?
Yes, sir.
Yes, sir. Thank you. But Ben, you don't have any irritable bowel movements. You're Superman, right?
I think I'm aware of it.
Yeah. Okay. Just making sure. Why is this important? Many choices you make on a daily basis affect your overall health, including regular doctor's visits, understanding the importance of getting an annual physicals. They provide red flags that can predict health concern or present diagnosis. Bullet point number 3, a visit to your doctor allows you to find out more about your body and prevent future health problems in the near future. Take medications as prescribed to prevent accidental overdose. For if your doctor were to give you, well, I wasn't going to use Ben again, Austin. So if you had a hurt knee or hurt ankle, and let's say you tore your ACL, your doctor's like, hey man, because your doctor's real cool with you. And anyways, he's like, hey man, this is hydrocodone. It's a pain reliever. You know, I want you to take it. It's going to make you. I want you to take it with food, so that way it doesn't upset your stomach. You'd want a doctor that's going to help you and benefit you, correct?
Yes.
Thanks, buddy. Yeah. All right. Read the side effects and understand the warnings of the medicine. So just as me and Austin just got done doing, know the warnings and side effects of that. How does it benefit me? Preventing illness in the early stages leads to an overall well-being for you guys. Preserving our health for our loved ones, such as family and friends. Taking control of your health can prevent serious diseases that can deprive you of living a healthy life. So that's how it benefits you guys. So remember that. Okay, finding a doctor. Ask for recommendations from family and friends. So as me and Wes were talking about, Wesley, he never had to do that and find what he needed to know, but how to find doctors, talk around. Speak, word of mouth is the greatest way, the easiest way that news is traveled, other than, obviously the internet and other types of news, but talking to your friends, you're going to be doing that more. You're not always watching the news every single day, are you, Curtis? You watch it every morning at 5:30, is that correct? Yeah, that's right. Okay, do your research and check the American Medical Directory for the doctors and their specializations, and whether they are board-certified physicians. For if they are not board-certified physicians, you have a big, big problem if they are not doing this and they're handing you out medications. And that's just Joe Blow in the street corner, giving you something that you have no idea what it is. So you need to help out. Identify your preferences. You and your doctor must work together as a team to make sure your well-being is great. Check to make sure the physician takes your insurance. That's why having a list of doctors and medical, like if you were going to go to this doctor's office or this doctor's office, that's why it's great to have a list of like 3 or 4 of them that you prefer, because if they don't take your insurance, that's a big problem. It's going to be a lot of money, and it's going to be pretty bad for you. It's not going to help you out. Evaluate the doctor. Does the doctor? Okay, so now we're going to be brainstorming and critically thinking some more. It's more rhetorical. If I ask you the question, obviously you're going to answer, right, Dylan?
Yes, sir.
Yeah, very good. Does the doctor listen to you and respond thoughtfully? So, Dylan, would you want your doctor to listen to you and respond thoughtfully? Or would you want your doctor just to kind of blow you off and kind of just respond the way they want to respond and react the way they want to react, rather than reacting for your benefit?
Yeah, I would have them respond thoughtfully.
Trick question?
Yeah, I would have them respond thoughtfully, but.
Okay. Yeah, very good. Does the doctor discuss your concerns in a way that makes you feel comfortable? Does the doctor explain the results of the test? So if you were up, I put it twice. Does the doctor clearly explain the results of the test? Because obviously if your doctor's like, hey man, here's your test, see you later buddy, just threw you the test and kind of walked out the door, that's not a very good doctor, is it? That's a doctor who's not interested in your well-being now, is it, Dallas? A doctor that sits down with you, talks through your concerns, explains that, well, Dallas, here it is. You have this is your blood pressure today, this is your heart rate at this moment, this is your height and weight, explains the test results. That's good, correct? Mm-hmm. Very good. Does the doctor explain the reasons for medicines and effects you should expect from them? Kind of like how me and Austin's, I explained that he needs to take it with an empty stomach, or doesn't need to take it with an empty stomach because it's going to make him feel lightheaded and dizzy, and taking it with food is actually going to help you be able to digest that. What's up, Wes? You all right today? Mm-hmm. All right. Does the doctor perform careful and thorough examinations? Is the doctor going to refer to you other physicians for special health problems? So are they interested in, let's say you have anxiety or paranoia, are they willing to help you out and to send you to a specialist, or are they just wanting you to continue to see them? So a doctor that helps you out and is like, well, Ben, you've been dealing with paranoia and anxiety. You would want to go see a psychiatrist, or if you were like clinically depressed, Javier, you'd want to go see somebody. I had to throw that one in. If you were clinically depressed, you'd want to go see a specialist for that. You just don't want to go see your doctor who's not going to benefit you in the long run. Correct?
Correct.
Very good. All right. The patient bill of rights. This is your rights as healthcare consumers to help you out and to benefit you. That's why these laws are here. Information: you have the right to accurately and easily understood information about your healthcare. Choice: you have the right choice of healthcare providers. So you have the choice to pick your healthcare provider. That's gonna benefit your overall well-being. Assess. You have the right to have emergency care when you're needing an emergency. So if Ben were to miraculously accidentally hurt his leg, you know, deadlifting, what'd you say, or hang snatching 275, is that right? So, and you were to like snap your shoulder out of place, probably wouldn't happen to you, but if it did, Ben, you would want to have the right to emergency care, correct?
That's right.
Yeah, so that's why these Bill of Rights are so good. Participation, you have the right to know your treatment options. Respect, you have the right to consider respectful care from your healthcare provider. So you guys have the right to a healthcare provider to help you and benefit you in the long run, not just to benefit them. Confidentiality. You have the right to talk in confidence with your healthcare providers, the right to review your medical records. So if you have a doctor that's not willing to talk with you, and you don't feel confident talking to them, kind of like as I've addressed before, and somebody who just is more, if the doctor's more interested in their well-being rather than their patient's well-being, that's not a very good doctor. You know, it's not a doctor that's going to help you guys out. So there's the references. Let's see, I have something going on here. All right, so you guys have your sheets here. Everybody find steps to find a doctor. Did everybody find 3 of them?
No, I only got 2.
You only got 2?
Yeah.
All right, Dallas, help them out. What's one of those steps to find a doctor? I know we're going to jump down here. It's going to be crazy. We're going to go down here first.
Ask for recommendations.
Ask for recommendations. There's one, Dallas. Curtis, can you name another one?
Look through the phone book.
Look through the phone book. Is that what you guys got? Some of you guys have? That was on the PowerPoint? Javier, you got one, buddy?
Make sure your insurance covers that doctor.
Make sure your insurance covers your doctor. That's great. All right, reasons to get an annual physical exam. Wes, could you hit up number 1 for me?
Yes, screen for diseases.
Screen for diseases. Okay. Dylan, could you go to number 2?
Assess risk of future medical problems.
Assess risk of future medical problems. Austin?
Stay encouraged to live a healthy lifestyle.
Stay encouraged to live a healthy lifestyle. Ben?
Update vaccination.
Update vaccinations. That's a great one. David?
Update medical history.
Update medical history. Great, great. Curtis, can you help us out? Or number 6?
Maintain a relationship with your doctor in case.
A healthy relationship, one that's the doctor's going to benefit you. Okay. And Dallas, number 7.
Answer or address questions.
Answer and address questions that are going to help you. Okay, great, man. You're doing excellent. So now I'd like to read. You've already made a chronic disease and don't even know it. You already have a chronic disease. According to CDC, 133 million Americans are currently living with an undiagnosed chronic disease. Are you one of them? Have you noticed pesky symptoms that have gone away with a regular healthy diet, exercise, and proper sleeping habits? Chances are it could be something more serious. All right, you could save your own life just by getting a physical. 46.7% of all deaths in the United States could have been avoided by simply getting an annual physical exam with a doctor. According to Partnership to Fight Chronic Disease, these deaths were attributed to modifiable health behaviors such as tobacco use, poor diet, and exercise, untreated infections, and other things that physicians typically screen for and treat. A good physician will ask you about all of these lifestyle habits and many more. These tip your doctor off as to which test order and how best to evaluate you. Excellent. So, does everybody now feel like a informed healthcare consumer after today's lesson? Show of hands. Very good. Kyle, what about you, buddy? Oh, thumbs up. Silent thumbs up. Good job. All right. So that's all I have for us today. Next week, our next class, we're going to be talking about how to use your information to better your way, to better your well-being. So thank you for that, and see you guys next period.